Hi everyone, for this video recording, we're going to be covering the tissue growth, the modifications that might occur, and how the repair of a damaged tissue occurs. This learning outcome is important for us to start to understand some of the body's processes that can cause diseases. Most of the terms that are listed here, they're going to lead to the process that are abnormal, and actually some can be very harmful to our body, especially the ones that will lead to abnormal growth, and therefore it's going to lead to tissue modification. Even repair, if it's not well monitored by the environmental cues, it can lead to scarring that's going to not be ideal for our body and might cause even long-lasting diseases. Let's define these terms so that we can have a better understanding of what they mean and how they will affect our bodies. Hypertrophy is defined as an increase in the size of tissue without the process of cell division, meaning that the number of cells will remain the same. However, the cells will increase in size, as hypertrophy means more and trophy means nourishment. Here is a clear example of hypertrophy where if an individual goes to the gym and they work out constantly lifting heavy weights, they will increase the size of the muscle fibers and not the number of fibers. There are certain sports, like for example tennis, where the athlete will work on one side of the body more. If they are right-handed, they will work more the right upper limb, or if they are left-handed, they will work more the left side of the body. This will lead the athlete into having a stronger arm on the side that they are dominant. Of course, there are ways to try to make both sides even by working the less dominant side a little more at the gym, as I'm sure nobody wants to have this proportionate body if possible. The opposite of hypertrophy is atrophy, which is going to be defined as wasting away of tissues from either lack of use or nutritional abnormalities. Usually the prefix a, it has a negative connotation, like not or without. Can you think of a word that we already talked about that uses a as a prefix with this connotation? If you guys thought of avascular, this is exactly the same word that I was thinking of, which means not vascular, right? Contrary to hypertrophy, which is an overuse of the muscles, atrophy means that the individual is not using the muscles enough. Therefore, it is sort of wasting the muscle tissue and the fibers become smaller. Again, there is not reduction in the number of muscle fibers, they just become smaller in size. As we can see from the images here, the muscle on the left side is normal and the muscle on the right side is smaller, meaning that it has suffered atrophy. This sometimes happens, for example, when an individual has an injury and has to stay immobile for a long period of time, and therefore they do not use the muscles, especially of the limbs, like they should. In this case, once they recover, they will have to undergo physical therapy to be able to get the muscles back to the normal size and be able to have a full recovery. Apoptosis is defined as the death of cells. The word has a Greek origin that means falling off, in the same way that fruits fall off from a tree when it becomes ripe. In this case, cells usually have a lifespan like fruits, and once the time has arrived, the cells will die. Therefore, apoptosis usually occurs as a normal and controlled part of an organism's growth or development, especially during early development, to eliminate unwanted cells without releasing any harmful substances. This will happen by sudden removal of the survival signals or a dissociation from neighboring cells. However, sometimes there might be either external or internal cues that might lead cells to undergo an uncontrolled process of apoptosis. In other words, even though apoptosis is a normal process, what initiates this process might sometimes not be normal. The image demonstrates how this process occurs. First, you have the shrinkage of the cells. Then the cell membrane is going to rupture in a way that will break into several cell bodies, like seen over here. And then these cell bodies are going to get engulfed by phagocytosis and removed from the body. Necrosis is defined as the death of most or all of the cells in an organ or tissue. This can be due to disease, injury, or even failure of the blood supply. Sometimes the disease or the injury is what causes the failure in blood supply. When the cells in your tissue die, it can affect many different areas of your body, including your bones, your skin, and the organs. And we can see here on this image how the tissue is dying out on the toes of this patient. Fibrosis is the thickening and the scarring of connective tissue. Usually it's going to be as a result of injury. On the image to the right, we can see the deposition of material in the connective tissue, forming these patches right over here. This tissue is liver, so it's called a liver fibrosis. One of the worst types of fibrosis is the pulmonary fibrosis, and we can see right over here on the image that the lung tissue will become scarred in this condition. This will cause the lung tissue to thicken. It becomes stiff. It's going to make it harder for the lungs to work properly. As the pulmonary fibrosis worsens, then the patient becomes progressively more short of breath. There's currently no cure for this condition, but there are some medications and therapies that can ease some of the discomfort of the patient. It can be caused by multiple factors, but in most cases, it is really difficult to pinpoint what's causing the problem. Some of the factors are exposure, for example, to harmful particles like asbestos, coal, and silica dust. On this image, there are three different types of plasias. We have hyperplasia, metaplasia, and dysplasia. The suffix plasia is going to mean formation, growth, or proliferation. We already covered the fact that the prefix hyper means more. Therefore, hyperplasia means that you will have more growth, more proliferation of an organ or tissue caused by an increase in the reproduction rate of its cells, which you can actually see on this image right over here, how you're going to have a healthy tissue and there's going to be one cell that belongs to this tissue that will proliferate in a way that will cause hyperplasia. And also this process is often as an initial stage in the development of cancer, but not always this is the case. There is a condition, for example, known as endometrial hyperplasia, seen over here in this image, where the lining of the uterus, which is called the endometrium, becomes unusually thick due to having too many cells. When you compare the left side of the image, you're going to see how the endometrium right over here is thinner compared to the right side where it's thicker. This is not necessarily cancer, but in certain women, it does raise the risk of developing uterine cancer. Now, don't get hypertrophy confused with hyperplasia. Remember that in hypertrophy, the number of cells remain the same. However, here in hyperplasia, there is an increase in the number of cells. The suffix of the words is what will make the distinction here. As trophy, remember, it means nourishment. Therefore, think of it this way. In hypertrophy, there is a nourishment of the same cells. And this is what makes the cells in hypertrophy bigger. In metaplasia, where meta means change in form, there is going to be an abnormal change in the nature of a tissue. In other words, conversion of one type of cell into another. It's going to occur when the cell's normal environment changes for some reason, and this will give the environmental cues for a cell to divide into a different cell type. The most common type is the intestinal metaplasia. Here, the cells of your stomach are going to be replaced with cells that are similar to those, for example, of your intestines. Or in this example of the image, the columnar mucosal epithelium is converted into stratified squamous epithelium. Now that you know how each epithelia will work in your body, you should be thinking what this conversion from a simple columnar epithelium to a stratified squamous epithelium will do to that specific organ. We know that the simple columnar epithelium, in this case, it even has the microvilli in the apical surface. It's going to act to probably absorb nutrients, correct? As these microvilli, they are present to increase the surface area. Remember we talked about this? The stratified squamous epithelium, on the other hand, is more for protection. Therefore, we can probably conclude that an individual that has these modifications, they will have problems with absorption of nutrients in the digestive tract, right? If you don't remember this, then I suggest that you go back to Module 2, Learning Outcome number 3, where we discuss the different types of epithelia. Last, we're going to be talking about dysplasia. Dys, which is the prefix, means bad, painful, difficult, or abnormal. Therefore, dysplasia is a term that's used to describe the presence of abnormal cells within a tissue or an organ. When an individual is going to present with dysplasia, it usually means there is an increase in abnormal cell growth. Dysplasia is not cancer, but it may sometimes become cancer. It can be mild, moderate, or severe, depending, of course, on how abnormal the cells look under a microscope and how much of the tissue or organ is going to be affected. If caught early, it can often be reversed even. The most common types of dysplasia is the cervical form, which is caused by HPV, which is the human papillomavirus. Most women have this sexually transmitted viral infection at some point in their life, but most commonly the immune system is going to clear the infection that leads to the development of cervical dysplasia. There's also a vaccine that young teenagers and even adults can take before they become sexually active, and this will reduce the chances of developing this condition. The vaccine is called Gardasil, just in case you're interested in finding out more about it. Now, there is a different type of dysplasia, which is known as developmental dysplasia, and like the name says, it's going to be more common in children. It can affect many parts of the body, including the skeleton, but most commonly it is a form of what is known as a hip dysplasia. In this case, it refers not to abnormal cell growth, but it's going to refer to a misalignment of your hip joint. As you can see here on this image, your hip joint is going to be formed by the head of the femur and the acetabulum, which is a bone feature that's located in your hip bone. Therefore, the head of the femur, as you can see on this image over here, it will not articulate well with the acetabulum. This can definitely lead to pain in the patient's hip. And again, most people who have hip dysplasia, they're born with it, and it is not going to be related to a precancerous cell growth. It can sometimes be resolved with physical therapy, or in more severe cases, the patient does need to undergo surgery. When a patient presents with some of the events that were defined in the previous slides, there might need to occur some form of tissue repair, which is defined as the restoration of tissue architecture and function following an injury. This process can be done by either regeneration or replacement. In regeneration, the new cells are the same type as those that were destroyed, and normal function is usually going to be restored. In replacement, a new type of tissue develops, which eventually produces a scar and causes the loss of some tissue function. Most wounds heal through one of these two processes. Which process dominates depends on the tissues involved and the nature and extent of the wound. Inflammation is the standard initial response of the body to injury, whether biological or chemical, physical, or even radiation burns. All injuries will lead to the same sequence of physiological events. Before we talk about the process of tissue repair that is being shown on the image in the next slide, let's first define a little more what is inflammation and the processes that occurs to initiate this inflammatory response. The four cardinal signs of inflammation are redness, swelling, pain, and local heat, which were first recorded centuries ago by a guy named Cornelius Celsus. He's the one that's credited with documenting these signs during the days of the Roman Empire as early as the 1st century AD. A fifth sign, which is loss of function, may also accompany inflammation depending on the severity of the injury. In responses to injury, what's going to happen is that the mast cells that are present in the connective tissue are going to degranulate, which means that they're going to release their granules. What are those granules? They're histamine. Remember we talked about? And then histamine is going to work as a potent vasodilator, which means that it will increase the blood flow in that area of injury. These inflammatory mediators will then recruit white blood cells to the site of inflammation. Histamine also makes the endothelium, which are the specialized epithelial cells that line the blood vessel, become leaky. This allows the white blood cells that were recruited, like neutrophils, macrophages, in addition to the fluid, to move from the blood into the interstitial tissue spaces. This excess liquid in tissue causes swelling, as you can imagine. If you have more liquid, then it increases and it swells, and this swelling is more properly called edema. The swollen tissues will squeeze the pain receptors, which causes the sensation of pain. And then prostaglandins, which are a group of lipids with hormone-like actions, they're then going to be released from these injured cells, and they will also activate pain neurons. You can take NSAIDs, which are non-steroidal anti-inflammatory drugs like ibuprofen, which will reduce the pain because they are going to inhibit the synthesis of the prostaglandins. In addition, antihistamines decrease allergies by blocking the histamine receptors, and as a result, the histamine response, which basically is what initiated this entire inflammatory process. This diagram shows the wound healing process in 3 steps. Each step shows a cross-section of wounded skin. The skin is made up of epithelial tissue covering the superficial layers, which is also known as epidermis. And there's also going to be a connective tissue below the epithelial tissue, which in case of the skin, it's going to be known as the dermis. The wound extends through the epidermis of the skin and about halfway through the dermis, as you can see over here. At the base of the cross section, an artery is present in the connective tissue. Remember that there are no blood vessels in the epithelial tissue. Several small capillaries will branch from the artery, and they're going to travel into the upper regions of the dermis. In the first step of healing, there are inflammatory chemicals that are released from the injury site, and these chemicals, they will travel through the dermis and enter these horizontal arteries. Clotting proteins and plasma proteins also are going to initiate the clotting within the wound, and this is going to form a scab, which is clearly visible in the second step as this black and brown mass covering the upper regions of the wound. Below the scab, epithelial cells in the epidermis, they're going to multiply and they're going to begin to fill in the wound. In the dermis, the fibroblasts are going to bind the wound area with granulation tissue, which is produced by those cells. Laying down granulation tissue is going to restore the vascular supply, as indicated by the capillaries that are growing around the wounded area. In the third step, as you can see, the scab is gone and the epidermis has grown in and contracted to seal the upper portion of the wound. In the deeper regions, the wound is now completely filled with granulation tissue, which is now considered a scar tissue. As we can see, the inflammatory process, it limits the extent of injury, partially or fully eliminates the cause of injury, and also initiates repair and regeneration of the damaged tissue. Necrosis or accidental cell death causes inflammation. However, apoptosis, which we know is the programmed cell death, it does not initiate the inflammatory response. And this mechanism that inhibits the initiation of the inflammatory process in apoptosis is still under investigation, which is great. Can you imagine if every time our cells underwent apoptosis, this would initiate an inflammatory process? Well, it would seem that our body would be fighting infection all the time, right? In contrast, if inflammation persists, it becomes chronic and then it leads to diseased conditions. Arthritis and tuberculosis are examples of chronic inflammation. When a wound is more than 1/4 of an inch deep, then sutures or stitches are recommended to promote better healing and also to avoid the formation of a disfiguring scar. Cancer is a generic term for many diseases in which cells escape this regulatory signal. Uncontrolled growth, invasion into adjacent tissues, and colonization of other organs, if not treated early enough, are its landmarks. Health suffers when tumors rob blood supply from the normal organs. A mutation is defined as a permanent change in the DNA of a cell. Epigenetic modifications, changes that do not affect the code of the DNA but alter how the DNA is decoded, are also known to generate abnormal cells. Alterations in the genetic material, they may be caused by environmental agents, for example, infectious agents, or even errors in the replication of the DNA that will accumulate with age. Many mutations do not cause any noticeable change in the functions of a cell, but however, if the modifications affects key proteins that have an impact on the cell's ability to proliferate in an orderly fashion, the cells start to divide abnormally. As changes in the cells accumulate, they will lose their ability to form regular tissue. A tumor, which is a mass of cells displaying abnormal architecture, forms in the tissue, as we can see over here on this image. Many tumors are going to be benign, meaning that they do not spread nor cause a disease. A tumor becomes malignant or cancerous when it breaches the confines of its tissue and it promotes angiogenesis, which is the formation of new blood vessels, and then it spreads to other organs. The specific names of cancers, they're going to reflect the tissue of origin. So cancer derives from epithelial cells, they're referred to as carcinomas. Cancer in myeloid tissue or blood cells form myelomas. Leukemias are cancers of white blood cells, whereas sarcomas derive from connective tissue. And gliomas are found in glial cells. Cells in tumor differ both in structure and function. Some cells called cancer stem cells appear to be a subtype of cell responsible for uncontrolled growth. There is recent research that shows that contrary to what was previously assumed, tumors are not disorganized masses of cells, but have their own structure. So they're being in control of their actions.